I'm Dr. Neelam Ramana Reddy. I'm an orthopedic surgeon specializing in mainly joint replacements for the hip and the knee replacements. I started my career in joint replacement right after my post-graduation in 2000. I finished my post-graduation in 2000, worked in joint replacement clinics in India, and also went and did my MCH in UK in 2004. And following which, when I came to Hyderabad, I started first in Wockhardt Hospital. That was actually Wockhardt had moved into Hyderabad and taken over Kamneni Hospital in King Koti. That's where I worked for the first 8 years of my career, and then moved to Star Hospital in the last 2 years. My career in Wockhardt started, and initially we started mainly with hips and knee replacement and concentrating on a lot of hip resurfacings also. Slowly the work has all picked up, and over the last 10 years I can see our growth has really rapidly increased, and with technological advancements also our results of surgery and our recovery patterns have grasped much better. I was the first person in 2012 to do the Zimmer ISS navigation surgery in South India in Kamneni Hospital, and when we moved to Star Hospital we started our fast track protocols for knee replacement. This was the first time we started this in 2015 January, and since then we have not had a chance to look back at it. It's been an immensely popular methodology of doing knee replacements where patients actually recover much faster, get back to their feet much faster, hospital stay is shortened, and the most important during the phase is that they have much less pain during surgery, and the recovery protocols are much faster. Normally earlier patients used to probably use a walker or a stick for at least a month to 6 weeks after surgery. With the fast track methodologies where we are doing surgery with a much smaller incision, where patients are able to get out of bed much faster with less pain or minimal pain, and recovery at home also is much faster. So they're able to probably walk without a stick in 10 days. So with this protocol, our patients have been very happy, and no patients after knee replacement ever go to ICU in our institute. We have a dedicated training system for the nurses, a dedicated physiotherapy staff that are available here who handle patients right from the pre-surgical stage. Physiotherapy does not involve seeing the patient after surgery. It involves even counseling them before the surgery about the surgical procedure, how your recovery protocols are going to be, and how you are going to manage yourself in the next 15-20 days. This was the first time we have written a press note, and we had done and launched with it in January 2015. And since from then we have done over 1500 replacements with the fast track techniques. With this methodology, patients don't go to ICU, don't have a urinary catheter, don't have a drain, and often no patient goes to ICU. They come back immediately to the room and are ready to eat lunch on the same day of surgery. Now, I was in Kamneni Hospital, which was actually Wockhardt Kamneni earlier. It was a multi-speciality hospital with all branches. During the course of our training and our practice in Kamneni, what we realized was a specialized center with a focus on certain aspects of the hospital discipline will give you better results. So I was approached in 2014 end to come and join Star Hospital, where we have a dedicated separate unit to handle orthopedics and neuro. And because it's a specialized center that handles only those two specialties, it is from the sisters, from the physiotherapy team, from the doctors and the theatre, everybody is trained to handle only specialized cases. So we do not see any cardiac patients in our block, we don't see urology patients in our block, because everybody is trained with a focus on orthopedics. From the time the patient comes and meets the receptionist to the time the patient gets to surgery and to discharge, there is always a focus, and people are much more trained in handling these joint replacements. This has been a major advantage in terms of trying to get patients to recover, because their whole protocols are much easier to handle and everybody knows what they're doing. We have an emergency department here in Star Hospital that's around a 15-bedded emergency department, very good at handling all trauma cases. So trauma has been something that we have tried to put into the picture, but we have been doing a lot more cold orthopedics that we call joint replacements. Arthroscopies are really picked up. Whenever a patient with an emergency just come through, then they're handled in the emergency department, where we have a trained emergency doctors who are specialized in emergency medicine and neuro and orthopedics. So with the specialty care, they're able to get patients to diagnose them faster, treat them faster, and get much better emergency care to the physicians. I did my MBBS in Bangalore, and it's that university that I actually achieved a gold medal for the whole 5 years, and I was the best outgoing student for the batch. That was the first achievement which we had, and then immediately after that I did my post-graduation, where it was a routine protocols of training. But in those days in post-graduation we were not so much aware about joint replacement or even arthroscopy is also as much that time. So it's during a later phase of training in UK where I studied for 1 year and did my MCH, where we got a lot more exposure to joint replacement. It's with these later advancements that we got to learn in UK and in Hyderabad also at that point, that we started our practice in 2005. And I was the first person to do navigation surgery in 2012 using the Zimmer ISS navigation, which was a new methodology of doing navigation. In 2015, we started the fast track replacements in Star Hospital. Star Hospital has been a major difference from compared to other hospitals because of its protocol based surgeries that we do, and also patients are able to recover much faster here because we have a dedicated staff and nursing care and physiotherapy doctors all trained in orthopedics here. Star Hospital has a small unit here, but then we dedicatedly do only joint replacement in this unit along with arthroscopies, and the results have been much better here as compared to our earlier surgeries. Okay. At Star Hospital, what we've been able to achieve has been a rapid recovery, less pain, less incision sizes. This has all been achieved because of a dedicated team that we have that includes the doctors, the physiotherapists, the anesthetists, and the critical care and emergency staff also. Here at Star, everybody is adept to handling orthopedic cases because that is what we do maximum. The other departments that are here are neurology. So because of the dedicated staff, we're able to give much better results and much faster recoveries. At Star, what we have been doing is not only primary knee replacements. It's during our trainings. Every year I tend to go abroad and update ourselves. I went to Germany this year and to Netherlands. So with these trips, we are able to update our knowledge into what is happening current and bring back the same methodologies to India here and at Hyderabad. At Star Hospitals, we are actually doing a lot of revision joint replacements also. That means patients who have had knee replacements, let's say 15-20 years back, and who are not able to walk because the implants have become loose, doing revision replacements also very well. So with the laser advantages and better technologies that we have here, and with fast track technologies and fast track methodologies that we use, we're able to get patients to get back to their feet much faster, recover faster, and the most important is have a feedback from them that their recovery through joint replacement has been relatively pain-free, and are very happy with this procedure. I'm very happy to tell you in the last 2 years, we have done a lot of joint replacements. We have covered over around 2,000 replacements that we have done in the last 2 years, and our patient satisfaction has been much better than before. We have very few patients. Earlier, when I used to do my replacement, let's say around 8 to 10 years back, out of every 10 patients, even 5 or 6 used to feel uncomfortable about the procedure. Now that number has come down to only 1. So out of every 10 patients, only 1 has a little bit of problems in the recovery protocols. But 90 to 95% patients recover much faster and are leading a relatively pain-free life, pain-free recovery protocol also.